Mohammed El Salmi feels helpless. There's nothing he can do to help his mother. The hospitals in Yemen's capital city of Sana'a, like most across the country, are either out of essential medicines and medical supplies or running dangerously low.
My mother is one of the patients, and she's been suffering from kidney failure for 2 years.
And with little money, Salmi struggles to afford the few supplies that are available. A sea and land blockade by a Saudi-led coalition has limited supplies into Yemen, and its hospitals are close to collapse. The Saudi-led coalition says the blockade is aimed at stopping the flow of weapons from Iran to the Houthi rebels. It imposed it earlier this month after a missile was fired from Yemen toward the Saudi capital of Riyadh. But UN officials and aid agencies say the clock is ticking for civilians as supplies of food, clean water, and medical aid are running dangerously low. All that in a country they describe as suffering the world's worst humanitarian crisis. The World Food Program and World Health Organization say 7 million people are on the brink of famine. There is also concern that a cholera outbreak among more than 900,000 people could further spread. And the World Health Organization says without vaccines and medicine getting through the ports, the fast-spreading diphtheria outbreak that has already killed 14 people, mostly the young, now threatens 1 million children. The United Nations has called on the coalition to lift the blockade.
Hundreds are dying in the Gomharia and Al Thawra hospitals because of the lack of medicine and other medical supplies. There are also severe cases that need to travel abroad but can't, so they die in the hospital.
Like many in Yemen, Talab watches the war and hopes the aid needed to save lives will one day arrive. Chelsea Carter, TRT World.